Okay. Welcome back. You know I love to talk about innovations in healthcare. Well, how many of you listening this morning remember when doctors made house calls? Not many of you, I bet. Well, if I told you that you could get a complete physical in the comfort of your own home, would you believe me this day and time? Well, you can. There's a company in Metro Atlanta called 2U Medical, and its president and founder, Linda Duxbury, is here with us today. Welcome to the show, Linda.
Thank you so much. I'm thrilled to be here.
Well, tell us, how did you fall into this or develop this company?
Well, I'm a nurse practitioner, first of all, mid-level provider, not a physician. And this is really my attempt to simplify healthcare. It's a modern rendition of the old-fashioned house call.
That's great. That's great. So for our listeners who don't understand what a nurse practitioner or mid-level is, I got to tell you, we are very supportive at the ENT Institute. I think we currently have 7 mid-levels. And mid-levels are, between the patient and the doctor who can provide care and currently are under, if you will, supervision of a physician. And there are 2 types. There are nurse practitioners and physician assistants, and we don't differentiate between the 2. The nice thing about nurse practitioners, they have the ability to operate and see patients independently, though, without the physician being there. So this is innovative, to get quality care and to get it when you want it.
Well, it does, and we're at a price point that's probably more affordable for most people as well. When you're talking about a concierge service, will come out for $175. An MD probably won't come out for less than $300.
Right.
So if you can find one, there are some that do it. But
so what services do you offer?
So typically we treat almost anything you would go to urgent care for. If you suspect a broken bone, you have chest pain or very acute, sharp abdominal pain, we're not the phone call to make. But treatment of minor illnesses, minor emergencies, we do some physical exam things as well. We don't have people take off their clothing, so there's certain things we can't do outside of the exam room.
Sure.
But certainly comprehensive blood work, lab panels. We work with physicians as well, specialists too. So we can truly be extenders, or we can function autonomously. So it just depends on what the need is.
Well, you really are a concierge.
Yes.
In many ways that physician concierge practices don't seem to be. That's right. I mean, you actually go to the home. You will actually take patients to the doctor's office as well, to the specialist when you need them as well.
We function as advocates.
Well, what's the most
Certainly.
unusual request that you've had from a patient?
Oh, goodness. I'd have to say unusual but appropriate request.
Right. That's a tricky one there.
Yeah.
Be careful.
What I would have to say, implementing a certain treatment from a doctor in California and required some research
Right.
to do
So they were
prior
visiting
to
here.
and special consenting. And so
Yeah, Atlanta is a destination location, so you do see people who fly in.
I do.
So do you ever get anybody flying in and they're at a hotel and they call you?
Most of my patients come referral based. I've got some great key influencers that send me patients. My medical director, Dr. Bobby Kaufman,
Yes.
he is the movie doctor in town. So I've been fortunate to meet a lot of actors here on location.
Right.
Sometimes we even get put on retainer to kind of walk someone through certain conditions that they might be experiencing where it requires coordinating with a specialist. So,
Wow, that's exciting. That is
exciting.
innovative. That is innovative.
Yeah.
Now, tell me, does insurance work with what you do, or is this totally cash?
We do
and
not
carry?
take insurance. It is cash-based. We require payment at the time of service. A lot of our patients keep a credit card on file. We are fee for service. We can be retained for really any length of time, and that determines the price is determined on the need. So,
So people can purchase service over a year's time?
You
in
could
advance?
do a
Or
retainer for a year, certainly. But I think what people find the most refreshing is that it's fee for service.
and you're transparent in your pricing.
We are.
Oh, so how do people find out about that? Do they go to your website for that?
The website, and again, it's word of mouth. I have a lot of great friends, some special relationships, Jet Centers Aviation.
Sure.
They refer a lot of business, keep people healthy so they don't miss their flights. I've got a wonderful friend, Rosina Seidel, with Dorsey Alston. She refers a lot of people to me.
So your business is growing.
It is.
And how long have you been in business?
Just 2 years.
So what has happened over this past 2 years in your practice development?
Well, we've grown tremendously from the business side. Revenue's up 168%. It's very affirming. I think we're on to something here.
That's great. That's great. Once again, we're talking to Linda Duxbury, who's president and founder of 2U Medical. How many different providers do you have currently?
Well, for mid-level providers, it's me, and I have a PA that works with me as well. As an independent contractor, I've got some ICU nurses, RNs, that work with me as well. So everybody,
you're adding.
We're adding. So
Yeah.
we're just filling the needs.
Well, and I
So-
think the innovation here is to be noted is, as our motto is, it's your health, your money, and your choice. And you are a model of that. People now are searching the internet. They're asking around because people are going to be more financially responsible for their healthcare dollar than ever before. And I predict in 2015, pretty much if you're going to get health care and it's under about $10,000, maybe even higher, you're paying out of your pocket. So people want to find innovators that deliver high quality at a lower cost of health care, even though most people don't associate high quality with low cost. What's
Well,
your experience with that?
that is absolutely so true. So add in convenience, add in privacy. Those
Tell
are
us
two
about
things.
do you have a story about convenience? Because that's important in what you do.
I do, yes. So picture this, a young mother home with 3 children, all under the age of 4,
And
18
not
months
hard
apart.
to picture that.
There
Not
are a
this
few
day and
people out
age.
there like that, right?
Yes.
So mom's so busy taking care of the kids, the family, that she's not taking very good care of herself at all. So what started out as seasonal allergies turned into bacterial sinusitis. Before we knew it, she was feeling terrible. And she called. She got my number from a friend and came out, took care of her with 3 little people watching right there on the couch with mom. And we got mom feeling better right away. It was a
Well,
really sweet experience.
What did the kids think about you being there? Do you wear a white lab coat?
No, we don't wear anything.
Wow,
That's one thing.
That's less scary.
Yeah, we're very discreet. There's nothing to indicate that there is a medical professional at your house. So, but no lab coat. They all had to try out the stethoscope. They all had to, look in each other's mouths with the otoscope,
They
light.
love that.
And
Yeah.
it was just, it was fun. Get
That's
them involved.
great. That's
So-
great. So now you have patience for life. For the not too distant future, anyway. That's
Yes.
great. That's great.
Thank
So,
you.
what's your experience been with specialists? Because sometimes you need to send someone to a specialist.
Right.
They're pretty receptive to hearing from a mid-level provider that they have a patient for them.
They are. I feel really fortunate to have special relationships with a handful of specialists that I can send a text message to
Wow,
for
that's
kind of that
great.
backdoor entrance.
That is concierge.
And they're very receptive. We bring a patient that is most likely insured with good insurance that will pay their specialty fees, and we do the paperwork. We are very familiar with the patient, the medical history. So we kind of just bring them in and make it really easy on them, and then coordinate whatever needs to be coordinated. So.
Wow, that's amazing. So to me, there are a lot of services that you offer. So what is your website?
2U Medical, the number 2, the letter U, medical.com.
And that's the best way for people to get in touch with you and find out what you have to offer.
It is.
That is great. Well, fantastic. We at the ENT Institute want to participate with you and be innovators in healthcare delivery. So we'll be reaching out to you soon about that, Linda. We appreciate you being on the show.
Thank you.
Coming up next, what do Elton John, Lady Gaga, and Candace Cameron have in common? My next guest, Dr. Jenny Burnett, knows because she too is a part of this group. You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.